As a patient, I want to know, what are my privileges and what are my responsibilities? Aloha, this is Dr. Matthew Dykema with Joyful Living in Hilo, Hawaii, and I'd like to answer that question for you. I say privileges because a lot of times in modern society, we've been words thrown around like rights to healthcare or rights to access. And I've just come to find out where I live, it's not a right, because if it is, everybody would have it. Everybody would be born with the possibility for that. But it is an absolute privilege to be able to access healthcare and to access doctors that are competent and that are willing to work with you and help you achieve your health goals. So, but the privileges that I would say that patients should have, hopefully, are the privilege to have a physician that would listen to them, that would hear their concerns, that would hear their heart, that would also listen to their body, and would be able to work with them to achieve their health goals. And I say that because I always tell patients, I'm not the one to tell you what to do. I'm not the one that is going to be authoritarian, but I will partner with you and make recommendations for your health. But ultimately, your health is yours, and that's the responsibility, is taking ownership for your own health, and but working hopefully with a compassionate doctor and healthcare team that will help you to achieve your best life now. And that's what we hope to do here at Joyful Living. As far as patient responsibilities, I did want to discuss a few things because I think setting expectations for this is critical. Who's responsible for what knowledge, for what information, for what actions? And there are several patient responsibilities that I think most people are aware of, but sometimes these are things that are easily neglected. So patient responsibility number one is simply to know yourself and to be honest with yourself. So I would encourage patients to keep, again, a record of their health and their health event of their life, so that you can be aware of what has happened in your life. And I know from personal experience, sometimes it's difficult when asked, well, when did such and such happen? Or when did you have this surgery? Or when did this event happen? And if it's been more than a few months, sometimes it's hard to recall the actual specifics of when it happened. And I can tell you, as a physician, it's very important to know, at least in general, when something happened. It can be critical to know, especially for screenings and in order to make appropriate guidelines and recommendations for patients. So I just encourage you as a patient to know yourself, and also to take notes and to write it down, so that you can go back and reference it, whether it's a surgery, whether it's a procedure, whether it's a medication that you're taking, whether it's food that you're eating, water, beverage, whatever you're putting in your body. Know what substances and things you're doing that may be affecting your health, and develop an awareness of that. What are the things that affect my health? And don't ignore it. It's very easy in a culture and society that we live in to ignore things that can be harming us, and also to neglect the things that can be helping us. So know yourself and be able to communicate that. And that's the other second responsibility, is communication. So I think communication is vital and important and key. So please be an advocate for yourself. Speak up and write things down. If you're not sure, that you'll remember when you go to your doctor's office or your doctor's appointment, write it down. And that way we can communicate what you need. And ideally up front, not on the tail end, but just coming out up front. Hey, these are the things that are really important. These are my concerns. These are my issues. And also following up. So I believe in closed loop communication, which just simply means that if I tell you I will meet you at location B at D time, and I'm not there at at location B at D time, then it's your responsibility to follow up with me. Say, hey, I thought you were going to be here at location B at such and such time. Or if I say, hey, I'll give you a call when you get your lab results back and we can go from there. Well, if you never get a call from myself or my staff, then, and it's been a week or whatever reasonable time for that situation, that circumstance is, and you haven't heard back, then as a patient, it's my responsibility to call back and say, hey, I did my labs, but I never heard back. Did doctor see those reports, or was he able to review those? And same thing for referrals. I always tell patients, give them a week or two to process things and to call you to schedule, but if you don't hear anything back, give them a call. So communication back and forth about our needs, about our wants, is just so vital as a patient to be able to, work towards our best health. The other thing I would say that is a responsibility is to be your own advocate, and to be responsible for your own health. And what I mean by that is I tell patients, and I care deeply about my patients and their health and their overall, and by health I mean mental, physical, spiritual, emotional health. I believe we're whole beings. We're not just one aspect, which is our physical body, but we're whole beings. And I tell them I care deeply about your health. That's why I'm in the profession that I'm in. But if I care more for your health, and if I care more about you than you care about you, then we have a mixed match of expectations. And so getting to that point where you are able to care for yourself. And there's some patients that really, they have a breakdown, and whether it's because of depression or whether it's because of past events and things, they don't have a lot of self-care, but that's something that we can work on. That's something that we can grow. But be an advocate for yourself. Other responsibilities is when you come to your doctor's appointment or whatever it is, health appointment, be prepared. Know what you want to ask, know the issues that you want to be addressed with, and be prepared, and call and make an appointment if you need it. Don't wait until it's an emergency to call in, and don't let things linger and get worse. I am a big believer in that if we can address things earlier, we can avoid a lot of problems and a lot of issues. And so as far as I'm concerned, if there's something that you feel is not quite going right, call and schedule an appointment, or call and we can make some suggestions and recommendations. And on that end too, show up. And I know it sounds so silly, but please do show up to your appointment on time. If you can be early, that helps. It really helps to make sure that we can get whatever paperwork needs to be done, and so that we can see you in a timely manner. If you show up 15 minutes late, then unfortunately it puts everybody else behind you back as well. And as a physician, I try and spend as much time as is needed with each patient. I try not to look at the schedule and say, well, this is a 5 or a 10-minute appointment or a 15-minute appointment or a 30-minute appointment. I try and give the person in front of me the attention that they need. But that being said, it is important that we are mindful of each other's time, and I try and be mindful of my patient's time. I oftentimes, unfortunately, run late, although I do run on time as well. But if you show up on time to your appointments, or even a little bit early, that's very helpful, so that we can be most efficient in what we need, and if you come prepared. And the other thing is, if you aren't able to make it for some reason, just call and cancel. That allows us to fit in other walk-in appointments or other patients that need to be seen, because again, in a day and age where physicians are at such a shortage, each appointment is so valuable, that time is so valuable. So if you're not going to be able to be there, please let us know. That way we can offer that time slot to somebody else. The other part that I think is so important, and I mentioned this a little bit earlier, but another responsibility is, and it goes along with knowing yourself, but know what you're doing, what you're taking. So if you're on medication, know what the name of the medication is, know what the dose of the medication is, know what it's for. And I would just advise anybody not to take anything if you don't know what it's for and what it's doing for you. I truly do believe in educating my patients about all aspects of their health. Not that I can give everybody a degree in it, but the ability of to understand. I think it's important to understand what are the medications that you're taking, why are you taking them, and then that's also important when you come to a physician's visit or a healthcare visit, so that they are able to know what's going on. And in the same way, whether it's medications, I encourage people to know what supplements you're taking, and know what food you put into your body, and know what beverage you put into your body, how much, how often. These are things that we do out of habit, out of routine, and sometimes we don't take the time to really assess what we're doing and whether or not that's something that we want to continue doing. So back to knowing yourself, but know specifically what medications or supplements you're taking and the dosages of such. And I think that's just so important. And another aspect of patient responsibility is to know and recognize what are my barriers towards health. What are the things that keep me from achieving my best health? And sometimes that can be old habits, sometimes it can be old beliefs, sometimes it can be our own seeking enjoyment in the moment versus in the long term. And that's okay, by the way, as long as you're aware of it. But come to recognize those things within yourself that are potential barriers. And I'll just give an example for colonoscopy. Oftentimes I may recommend a colonoscopy for somebody for screening purposes for colon cancer. And sometimes patients are 100% on board because they had an experience where their father, they found out that he had colon cancer and they were able to take it out and remove it, and he survived and it didn't metastasize anywhere, and they had a good experience from catching something early. And so they want to get signed up as soon as possible, sometimes even early, because they said, hey, that's in my family. I had a loved one, a relative that got a colonoscopy, and they're still alive today because of it. It saved their life. And then on the other end, I have patients who they had a loved one that had a colonoscopy, and although it's very, very rare, they had a complication from it. Maybe they had a perforation, or they had a bad outcome, something that happened negative. And so now they associate colonoscopies with a very negative outcome. And they said, I don't want to do a colonoscopy. That's the last thing in the world I want to do, because if I do that, I may die. And so recognizing our own biases, our own fears, and trying to be able to take it and look at it and see if that's the perspective we want to continue to have. And I think that's an important aspect of our healthcare, is being able to recognize our own biases, and then being able to change them if it doesn't meet our health goals and where we want to be. And that's the probably the last patient responsibility that I would say, is to set goals for your health and for your future. And you can have a month goal, you can have 3 months, a year, 5 year, 10 year, depending on where you're at in the spectrum of age and life. I think it's important to set goals and to look at the future and not just at the present, so that hopefully you can position yourself in the best position to be as healthy for as long as you can be. And I heard a parable one time that talked about to two different people, but they said, what would you rather have? Would you rather have all the money in the world, and you could buy anything that you wanted to, and you could do anything that you wanted to because you had all the money in the world? Or would you rather have the best health in the world? And the one guy said, well, I want all the money because, I want to be able to do things. I want to be able to travel. I never had much money. And I think if I had money, that would fix everything. And unfortunately, he blinked. He got all the money in the world, but all of a sudden his health started to fail, and he didn't feel strong enough to be able to walk. He didn't feel good enough to be able to do anything. And, he had all the money, but he couldn't enjoy it. And then on the other spectrum, you had somebody who doesn't have much, and, they can't go, and they don't have all the resources in the world, but they have health, and they're able to live life with health. And to me, obviously it'd be wonderful to have the best of both worlds. But I think our health is so important and critical that if we have health, we can work towards anything and everything else. If we don't have health, all of our dreams, all of our hopes, everything for the future oftentimes get cut short. And I see that with so many people, whether with, unfortunately, Steve Jobs and his bout with pancreatic cancer, which by the way is very challenging to treat, but he had all the money in the world, and unfortunately the cancer still took his life. There are things in life that we can't control. And even as a physician, there are oftentimes where medicine does not have the answers. But we can work towards it, and we can strive towards it to live our best life and our healthiest life. So I hope that was helpful for you, but those are the main patient responsibilities that I think are important. The other thing I just would mention too, like if you have something, let's say you are on a medicine, or you're getting ready to go on a trip or something, and you look and you say, man, I don't have any refills on this, or I don't have enough medicine to last me this trip. Call and be proactive. Don't wait for you to be on your trip and the medicine's gone, and how do I take care of it? And I guess that's where setting goals and looking ahead is important, because we do live in a time where the here and now is often much more valued than the next steps. And I think both are important, and we don't want to neglect either. So please let me know if you have any other questions about this particular topic. I'm going to be posting other videos, and I think I mentioned also about keeping a health journal. I'm going to have a separate video for that. If you would please like this video, please subscribe to my YouTube channel. That way when I develop new content, you'll be able to get notifications that it's coming out. I hope this is helpful to you, and look forward to more conversations in the future. Aloha. God bless.